Good morning. Thank you for having me.
Yeah, happy Heart Month.
Happy Heart Month.
That's it, February. Is it
It's
because
gotta
of
be.
Valentine's Day?
I'm going to say yes, but we don't know.
That's an optimistic approach.
Yeah, that's how I
like
have to be. That's how I have to be, for sure. So Heart Month. Tell us a little bit about what you guys are doing.
Yeah, so we do a lot of different things. I've been posting stuff on social media for Heart Month, trying to educate people. We have educators going into our schools to educate children about physical activity and healthy eating. We have our WIC clinic, Women, Infants, and Children, who help out eligible families, help them be able to afford healthy foods and guide them in their eating choices.
Jackson County is not a healthy county when it comes to our heart.
No, you can see us there in the red. Historically, we've been in the top 20 counties in the state of Michigan for heart disease deaths. You can see that all of them are actually in the lower peninsula there. Heart disease is the leading cause of death and hospitalizations in Jackson County.
Wow.
Yeah, and that's why I'm here today.
So when
More people die from heart disease in Jackson County than any other cause.
Yeah.
Wow.
That's great. That's amazing. So when you look at it, look at the state of Michigan, what do you take away from, like, how does it look like in Michigan? Obviously you see that, but how concerning is that? And then what are some things that maybe individuals can do for themselves?
Absolutely. So it's very concerning because it's not just Jackson County. Heart disease is the leading cause of death in the state of Michigan as well as the United States, and it has been for a long time. So when we approach the question, what do we do about it? You have to understand that there's a lot of things that contribute to heart disease, right? So Michigan, first of all, historically has been ranked 7th in the nation for the number of deaths per year caused by heart disease. So we are high up there. And again, there's a lot of things that contribute to heart disease. So I'm not even going to remember them all, but just listing them off: smoking and vaping, your family history, high blood pressure, high blood cholesterol, things your doctor tells you about, diabetes, your level of physical activity, your weight, specifically the fat mass that you have, your diet can contribute to heart disease, your sleep hygiene even, and your stress levels. So what I want people to take away today is I want people to start with something small in your life, make a small change, because it's hard to address all those things. I have a very healthy heart, but I know that I don't get enough sleep. Nobody's perfect.
What can people do to reduce some of the risks?
Start small.
Yeah.
Just pick one thing, because I just listed off a lot of things.
Yeah.
So for example, I feel like a lot of people talk about not wanting to, say, exercise after work because they're really tired after their jobs. I would encourage people to actually look at their sleep hygiene instead. Like, what time are you going to bed? Can you go to bed 20 minutes earlier on a weekday? Like, what are you doing? Are you up phone scrolling? Like, can we stop the doom scrolling and maybe get to bed a bit sooner? Maybe your body will feel better.
Yeah, there was a study recently too that with the doom scrolling that I think Americans spend, I can't remember what it is, but just searching for something to watch, the hours on that are ridiculous. So I think something easy. A lot of people are on their phone in bed every single night for hours. That's one thing. Now, when you say sleep hygiene, is how important is sleep to your heart health?
Oh, it's very important. Your sleep habits. So we're supposed to be getting about 7 to 8 hours of sleep per night. Now, that is up to the individual. I feel like I need more than 7. If I just get 7, I'm sleepy.
Yeah.
But when you get that recommended amount of sleep, or whatever amount of sleep works for you, you have it's been linked to lower blood pressure, lower cholesterol levels. So it's very important.
Well, you mentioned you have a healthy heart. You are a marathon runner.
I am.
So we'd all love to aspire to that
That's
level
right,
of
honestly.
fitness, but we'd have a long way to go to get to your level. But you're right, the little things. I have an idea. I thought of one.
Okay.
When you order pizza at a restaurant and you don't finish it all and there's just 2 pieces there, don't say, oh, well, let's just finish it. Don't finish it.
Yeah.
You can save it for later. Just eat till you're full. And I would say even with the pizza, that's a great opportunity for a small change.
Sure.
So can you, if you want pizza, eat pizza, but maybe consider getting some vegetables on your pizza. Can you opt for a protein? Like you can do like a chicken ranch pizza, get some like protein in there. It's going to help you be fuller for longer.
What
We're
are
still
some
doing extra cheese. Do people still order extra cheese
from
on
one
pizza?
one
Who
place?
is-
I do from one place as a topping.
Who is
So
doing
it's-
that?
I am just on one. Just
Where?
C&J?
Extra cheese? Are you kidding me?
No,
I,
but it's not like what you think.
extra cheese, and then they put it in the
It's,
thing,
listen,
the crust.
I love that. No, not that. Not that. What are some barriers that people face? Especially right here in Jackson.
So many barriers, so many, and that's the reason we see it as the leading cause of death. So I talked about work and having a hard job and how maybe you should look at your sleep hygiene. Affordability is a big deal. Healthy food can be hard to afford. For me
Sure.
personally, I have found that if you buy fruits and vegetables on sale, you can save some money there, but finding affordable lean quality protein can be hard, so shop around. See what stores have sales. So when I say lean protein, I mean things like poultry and eggs and seafood, beans and legumes.
Have you seen the price of eggs lately, Heather?
I have seen the price of eggs, but I've always bought expensive eggs.
They're eggs. You need to have eggs. Eggs, milk, bread.
Eggs, they're America's edible, incredible egg.
Yeah, that's right.
Yes. Well, they're $5.15 a dozen right now.
Oh,
Really?
wow.
Yeah, nationwide average.
Well, nationwide average.
Yeah.
So, well, like you said, try.
That means nothing to you because you don't know how much eggs are.
No, I'm lactose intolerant, so I don't look at the price of eggs. Sorry.
Exercise. So I would say, based on you, exercise probably is what you are crediting with your healthy heart.
Absolutely.
How little? Like, what's a good starting point?
Yep, so it's going to be different for anybody depending on where you're starting from. So the recommended guidelines for adults are 5 days a week, 30 minutes per day, at moderate intensity. So think of that as like you can talk while you're working out and you're sweating, but you can't sing someone a song, right? But that's 5 days a week, 30 minutes per day, and that's not really achievable for a lot of people, especially if you're coming straight from the couch. So, have that conversation with your doctor about where a good starting point would be. Maybe you just start with getting in more steps per day. Maybe you have a desk job and you can recruit a coworker to go walk around with you every hour, go on a 5-minute walk. Just try to get more movement into your body, and then maybe start working up to like 10 minutes of structured exercise 5 days a week. I'm not a doctor. I can't give people specific guidelines. It depends on the person. But start small. Start small.
Great. Heather, thanks for coming in.
Thank you for inviting me.
Thank you.
Happy Heart Month. Heather Czarnecki from the Jackson County Health Department. More of the morning show after this.